Knock, knock, knock. Hi, my name is Allie. I'll be your nurse today. Can you please tell me your name and date of birth?
Joby Latham, 10/13/90.
Alrighty, and then can I just see your wrist, please? Okay, so I have the right patient. So patient appears to be as stated age and doesn't seem to be in any distress. Her posture seems normal and doesn't seem malnourished. She doesn't use any ambulatory devices and her gait is smooth with little arm movement. Her mood and affect seems to be normal per the situation and she seems well groomed with no odors. I'm assessing for any abnormalities and she doesn't seem to have any. Can you please tell me your name?
Joby Latham,
And where are you?
in quarantine,
And what year is it?
2020.
And then what's the reason for your visit today?
Just yearly checkup.
Alrighty, so patient is LOC times 4. And then can you please rate your pain on a scale from 1 to 10, 1 being no pain at all and 10
1.
being the worst? Okay, so now I'm going to test your cranial nerves. I'm going to start off with olfactory. Can you please close your eyes and then close one nostril? And then can you tell me what you smell?
Coffee.
Okay, and then open your nostrils and now tell me what you smell.
Coffee.
Alrighty, so olfactory is in check. Next I'm going to do optic. I have a Snellen chart 20 feet away. Can you please read line 7 with your left eye covered from left to right?
JOBY.
Alrighty, and then can you cover your right eye and then read it from backwards?
YBOJ.
Alrighty, and then with both of your eyes open, can you read it from left to right?
JOBY.
Alrighty, so patient has 20/20 vision. Next, I'm going to check your oculomotor, trochlear, and your abducens. So I'm going to do Perla. So I'm going to look at your pupils. And the client's pupils look like they are a 3. And that's normal. Then I'm going to see if it's reactive to light. His pupils are round and equal, and it does react to light. Reacts bilaterally, so it does constrict. And then I'm going to do 6 cardinal gaze. So can you just follow my pencil, please? I'm looking for any nystagmus, which is any rigidness, and I'm not noticing any. So that's good. And then his pupils react to close and far movements. Now I'm going to do trigeminal. So I'm going to have you close your eyes and just tell me where you feel this.
Forehead.
Okay.
Left cheek. Right cheek. Below my lip.
Your
Chin.
Okay, and then you can open your eyes now, and I am going to have you clench your jaw. Okay, so I can feel that muscle flex. Next I'm going to do facial, so can you smile for me? Like smile. Okay, and then can you frown? Okay, and then can you raise your eyebrows? And then puff your cheeks? Okay, and then can you close your eyes? Can you open with resistance? Okay. So his facial cranial nerve is intact. I didn't see any asymmetry, no facial drooping, which is good. Now I'm going to do acoustic. So can you close your eyes and cover your left ear? Tell me what you hear.
1, 2, 3.
Okay. Now cover your other ear.
ABC.
Alrighty. So acoustic is intact. Now I'm going to do glossopharyngeal. So I'm going to have you open your mouth. Can you stick your tongue out? Okay, so tongue is midline. And then can you like flatten your tongue? I'm trying to see your uvula.
I don't know what that means.
Okay, his uvula is midline as well. Now I'm going to check and see if he has a gag reflex. Alrighty, so he has a gag reflex, and then can you lift up and can you swallow for me? Okay. Okay, so patient is able to swallow, so glossopharyngeal is intact. Now I'm going to do spinal. Can you please, can you, yeah, freaking it. Okay, can you shrug your shoulders? Okay, can you do it again against resistance? And then turn your head towards me. Okay, and then turn your head towards me. Alrighty, so he's able to use those muscles, so spinal's intact. Now I'm going to do hypoglossal. So can you please say light, tight, dynamite?
Light, tight, dynamite.
Alrighty, so the tongue movement is good and he has good speech. Now I'm going to do a hint. So now I'm going to look at your head. I'm going to see if there's any visible abnormalities, and I'm not seeing any. There's no lesions. Your hair seems evenly distributed. Your skin looks appropriate to ethnicity. It's smooth. I don't see any bruises or contusions or anything like that. So now I am going to palpate your skull. And I'm not feeling any masses, which is good. Now I'm going to look at your eyes. So I'm going to pull down your eyes. And his conjunctivi is pink, which is good. And his sclera is white, which is good. Now I'm going to look at your ears. So I'm going to see, I'm looking for any drainage. I'm not seeing any drainage. And no drainage bilaterally, which is good. Now I'm going to palpate your ears. You tell me if you feel any tenderness. No?
No.
Alrighty, so no tenderness noted. Now I'm going to look at your nose. And his nares are even bilaterally. I'm not seeing any polyps or drainage, no lesions, which is good. Now I'm going to look at your neck. So I'm going to palpate for your carotid your carotid pulse. I'd rate that as a 2. Let's check the other side. It's also a 2. Now I'm going to have you go behind you. Can you? Okay, so now I'm checking his thyroid. Can you swallow? Alrighty, so his thyroid isn't visible, so it's not swollen or anything, which is good. I was able to feel it, not feel it, but I know where it's at, and he was able to swallow, and when he swallowed, I was able to see it. Now I'm going to listen to your carotid for any bruits. I'm going to use the bell of my stethoscope. And no bruits noted. No bruits noted bilaterally. And now I'm going to check for your lymph nodes. And I'm not feeling them, which is good, so they're not swollen. Now I'm going to check for your jugular vein distension. So I'm going to have the patient in 30 degrees on the bed, but here we can't really do that. And I'm going to check to see if he has a distension on his vein. So can you just pick your neck up and look that way? And there's no known vein, so that's good. Now I'm going to look at your throat. So can you open your mouth? Alrighty, and so his mucosal membrane is pink, which is good, and it's not dry, and then his trachea is midline. Okay, so now I'm doing your upper extremities. So I'm going to look at your arms, and I'm not noticing any lesions, petechiae, bruises. There isn't any large masses or anything. Your hair seems to be evenly distributed bilaterally. I'm going to now push on your hand here, and there's no pitting. I'm going to check for skin turgor. There's no tenting. And I'm going to look at your fingers. I'm not noticing any clubbing. They seem flat. I'm going to check your capillary refill. So I'm going to press down. And I'd grade they went back to normal within 2 seconds, which is good. I'm going to check your warmth, or check your temperature. And your temperature is warm bilaterally, which is good. I'm now going to check your pulse, your radial pulse. And I'd grade that as a 2 bilaterally. Now can you close your eyes? Can you tell me what you feel?
Sharp.
Alrighty, and then can you tell me what you feel?
Dull.
Okay, and then can you tell me what you feel?
Dull.
Okay, and then
Sharp.
alrighty. So sensation on both arms bilaterally. His muscle tone, contour, size seems symmetrical bilaterally. Now I'm going to have you squeeze my fingers. Okay, I'd grade that as a 5. Now I'm going to have you push against me. Okay, and then pull down. Okay, and now I'm going to have you do abduction, so bring your arms up. Can you put your breath to touch your scapula? Now bring them forward. Okay, so patient has full range of motion, and his push and pulls are a 5. I'm going to check your radial pulse one more time. And I'm going to listen to that or feel that for 30 seconds. And his heart rate is an 82. Okay, now I'm going to do your cardiac. Are you experiencing any chest, shoulder, or jaw pain?
No.
Any shortness of breath?
No.
Alrighty, I'm going to listen to your heart now. So this is your aortic. I hear lub dub. And then the pulmonic, lub dub. And then herbs, lub dub. Tricuspid, lub dub, S1, S2. And then your mitral, midclavicular, 5th intercostal. And I'm not hearing any murmurs or gallops. I'm listening with my bell. I'm going to listen for 1 minute. Alrighty. Okay, so now I'm going to do respiratory. I'm seeing your chest rise and fall symmetrically. You don't use any accessory muscles, which is good. I'm now going to listen to, your skin is, your thorax skin is smooth and even with no lesions or bruises. I'm going to check for skin turgor, and it bounces right back, no tenting, which is good. Now I'm going to feel for skin temperature bilaterally, and it's warm. Okay, now I'm going to listen to your lung sounds. So every time you feel my stethoscope move, I need you to breathe in and out. Alrighty, so I didn't hear any wheezes, stridors, or crackles, no tachycardia, or tachypnea, sorry. And then can you turn around? I'm gonna do your posterior. Can you hug yourself? Okay, so breathe in and out, in and out, in and out. I'm going down 2 inches every time. I'm not hearing any crackles or stridor. Alrighty. And then, stay turned around. Can you just breathe one more time? Alrighty, so my thumbs went away and back, which means that his rib cage expands and then comes back normally.
Every day.
What's the color and the consistency?
Brown and solid.
And then how often do you urinate?
Every couple hours.
What's the color?
Light yellow.
Do you ever have any odors?
No.
And is there ever any pain?
No.
First, I'm going to inspect it, so I'm not noticing any umbilical hernias. His umbilicus is midline. I'm not noticing any lesions or any redness or any discolorations. It seems to be flat, no protrusions. It seems like he doesn't have any visible pulsations. And I'm going to now auscultate. So I'm going to start in the right lower quadrant. I'm going to use the diaphragm of my stethoscope. I'm gonna listen, and I hear active bowel sounds. If I didn't hear any bowel sounds, like if they were absent, then I would listen for 5 minutes in each quadrant. But I'm hearing active bowel sounds in each quadrant. I'm also going to listen for the aorta with the bell of my stethoscope. I'm not noticing any brutes, which is good. Now I'm going to percuss. So I'm going to go over his liver, and it sounds dull. And then I'm going to percuss the other quadrants, and I hear tympany. Now I'm going to palpate. Let me know if you feel any tenderness. Do you have any pain anywhere?
No.
Okay. No?
No.
No tenderness?
No.
Alrighty. So I also didn't feel any masses or rigidity. For CVA, let me know if this hurts or any tenderness.
No.
No? Okay.
No.
Alrighty. Okay, so now I'm going to do lower extremities. I'm not noticing any lesions or bruising. It seems smooth. I'm not noticing any arrhythmia or any lesions or anything like that. That doesn't seem swollen. The contour, muscles, and everything, they seem symmetrical bilaterally. Now I'm going to do a edema, so I'm going to push down on each of your feet bilaterally, and there's no pitting noted. I'm looking at your toenails, and they seem smooth with no rigidness or discoloration. I'm going to now do a cap refill, so I'm going to push down, and it went back within 2 seconds, so that's good. I'm going to do skin turgor, and it bounces back within 2 seconds. There's no pitting, which is good. I'm going to check your temperature, and it's warm on both sides, which is good. Now I'm going to check your popliteal. No, you can leave it down. Your popliteal pulse bilaterally, and I'd say that that's a 2, which is normal. Now I'm going to do your posterior tibialis pulse, and I'd say that's a 2 as well. Now I'm going to do your dorsal pedis, and I'd say that's a 2 as well, which is good. Now I'm going to do range of motion. So can you please bring your feet to the sky? Okay, and then can you put your feet to the ground? Alrighty. And that is okay. So patient doesn't use any ambulatory devices. He doesn't need any assistance while he sits or lays or anything like that. He doesn't have any restricted range of motion. Can you stand up for me? Did you feel any dizziness or anything with that? No? Alrighty, so now I'm gonna do Moenberg's test. So I'm gonna have you close your eyes. I'm seeing if you sway at all, and he doesn't sway. Now I'm gonna have you do heel to toe, and his balance is good. He's not swaying. And then can you walk back normally? Just walk normal. And his gait is normal with little arm swing, and his balance is good. Can you do on your toes? And then on your heels. Alrighty. I'm gonna check his spine, and I don't see any lordosis, kyphosis, scoliosis. So for his cervical, concave, you can stand up. So for his cervical, it is concave, and then thoracic is convex, and then lumbar is concave, and then his sacrum and coccyx is convex. Okay, so after I'm done assessing my patient, I'm going to do hand hygiene, and I'm going to lower the bed, put up the side rails. I'm going to give them the call light and tell them that if they need me to just use their call light. And then I'm also going to make sure that any of their belongings, like their phone or water or something like that, is within reach. And that is all.